Hi, my name is Audrey Bauer, and I'm one of the staff physical therapists here at Dynamic Physical Therapy. I actually work both in the outpatient gym as well as with our pelvic floor population, and even specifically with the male pelvic floor population here. Normally, what we'll see with this population is primarily a diagnosis of prostate cancer, prostatitis, both before they have a surgical operation and after. Typically, when we see these patients, they'll come in and they'll talk to us about symptoms of frequent urination, mostly at night, any kind of difficulty starting their stream of urine, or even fully emptying their bladder. This highly impacts this population because it's something that they carry with them throughout the day with every single activity they do. They can't really put their pelvic floor at rest when it's not functioning well, so this is something that they're typically wanting some form of really specific treatment for, and an immediate treatment as well. So in the beginning, when we see these patients pre-operatively, I'll do some form of education just to tell them what the pelvic floor is. Most of these patients are not aware of their pelvic floor and how it contributes to their symptoms. So what you're looking at in the body is the bladder that will sit on top of the prostate. The prostate will almost act like a shelf for the bladder that will rest on the pelvic floor. The urethra, which is where urine will actually flow out of the bladder, out of the body, also passes through the prostate. So when the prostate has an issue with it, such as the cancer or the actual inflammation due to the enlarged prostate, it's going to highly impact how the urine will flow out of the body. The pelvic floor sits at the base of all of these structures and is solely responsible for controlling the flow and the output of urine once it's time to actually empty the urine out of the bladder. Once the patients have an awareness of the pelvic floor and how it functions in regards to their bladder and their prostate, they'll come back to see us after their prostate is removed in order to retrain these muscles again that have lost some of their strength and their function. What we'll use is actually something very unique to Dynamic Physical Therapy, an electrical stimulation unit that will help to improve the patient's ability to control these muscles, as well as an internal biofeedback machine that will give them a glance at what their pelvic floor is doing when they're contracting and relaxing. When they gain the confidence in their control with the pelvic floor, we'll actually start training the pelvic floor with functional movements that's going to translate into how they move with day-to-day activities. This form of treatment is something that will be greatly beneficial to the patient overall in reestablishing their quality of life, and that is our main goal here at Dynamic Physical Therapy.